Thank you. It's difficult not being a doctor and addressing very many doctors here. So kindly excuse me if I make any medical references which are wrong. But of course, having worked in the health sector for over 5.5 years now, both in my capacity as Health Commissioner of Bangalore City as well as the State Health Commissioner now, I think more and more such awareness programs are required and is the need of the hour. As doctor spoke, it is today all about prevention, because when I see the demand for dialysis, it scares me. We have beds in our taluka hospitals, we have dialysis beds at district hospitals, we have very many NGOs running dialysis centers like daycare centers, and the waiting list is to be seen to be believed. And I only wonder how we are going to cater to the needs with every year us adding many lakhs of patients who end up with CKD, thereafter end stage renal disease, and then the options are very limited after that, as many of you have pointed out here, be it dialysis or a kidney transplant. We were just at a organ transplant, organ donation awareness program a couple of days back, where all the religious leaders had got together to convince people that organ donation is not averse to any particular religion. And when it came to kidney, we realized our waiting list was more than 4,500 people waiting for kidney transplant. So these numbers, these facts should really shock us. And the way ahead is really about prevention, awareness, consciousness about what we consume, our lifestyle. Today, processed foods are available at a click of a button. You don't really need to visit or go to a hotel or a fast food joint. Just a click of a button and you have all that processed food, high salt, which is very tasty, of course, but one shudders to see what the long-term impact would be. And with youth, children, including my children, addicted to foods like this, I really wonder where we are headed. So be it the national programs or the state programs, there has been a clear shift now towards preventive health care. The whole concept of health and wellness centers pushed forward by Government of India, and which is now being adopted in Karnataka, as you've seen the Honorable Chief Minister and the Health Minister have launched the concept of Nama clinics in urban areas, is basically focused on the whole concept of preventive health care and wellness. Early screening, early detection is the key. Just like what probably glaucoma is for eye disease being a silent killer, I would say kidney is also some, because correct me if I'm wrong, doctor, I don't think there are too many symptoms which come up too early, right? If in kidney disorders. So unless, as doctor mentioned, we get ourselves screened regularly, at least once a year, and in high risk populations at least 6 months once, it's going to be very difficult for us to prevent these, catch them early, get the right treatment so that we don't end up on the bed. A senior oncologist, Dr. Somshekhar, when I met him, told me one very interesting fact. He said, when you go to relatives, functions, birthday parties, please don't give them any gift. Just give them a free master health checkup so that at least they end up going and getting themselves screened and become aware of what they could end up becoming. So I think this is going to be a joint effort. I really appreciate the efforts of kidney warriors. You brought out a topic which is of great importance in the coming days, be it cancer, be it the lifestyle disease of diabetes mellitus, hypertension, CKD. These are going to be staring us in the face, and while we have the largest working population in the world and probably the youngest population in the world, it will not help us unless this is a healthy population, unless they can stand on their own feet without being dependent on drugs, medicines, treatments, and God forbid, organ transplant. So I would just leave this key message that wherever possible, in your own fields, please talk more about this. I'm very happy to see the booklets that have been brought out, which is all about lifestyle, which is all about nutrition. But one needs to really keep in mind that unless this is a ticking time bomb, this is a ticking time bomb which I have seen very closely from the department, and it is today not urban centric or only amongst the elite population. It spans across rural India. I think doctor would have seen it in Mysore also, the rural areas. We find dialysis patients even in the remotest of parts of the state and in the country. So in that regard, I think sessions like these are extremely important, thought sharing, and of course the treatment methodologies would have to improve over coming days. We need to ensure that quality of life is improved along with the treatment, and that is where all of us need to join hands. From the state, we have the state organ transplant organization, which is involved in the process of ensuring that organ retrievals happen in time, as well as the transplant, as per the transplant rules, the organ allocations do happen. So Karnataka is doing fairly well in this, but as I said, the demand far outweighs the supply, and we really need to be thinking hard. Probably this group here can come out with some kind of a action plan for the state in the coming days on what they need to do. Probably what Dr. Mani had charted out and presented. I mean, if that could be summarized and submitted to us, we are willing to look at it with open heart and ensure that we put in some kind of an implementation plan, because today the resources in terms of funding coming in from Government of India and the state government towards health is far higher and far better. Post COVID, there is this great thrust on preventive health care and also to an extent curative health care. So I think we should grab this opportunity and ensure that you come up with a clear agenda plan and what a clear wish list which you feel the government can help provide, and there should be convergence of efforts. Do let us know with whom to join hands so that they become force multipliers and we are able to deliver on the ground. Thank you for having me here. I would spend some more time with you and try to gather more information in this regard. Thank you again.